Let's everyone trickle in here. My goodness. All right. Hello, everyone, and welcome to How to Overcome COVID, Real Facts with Dr. Sana Khan, hosted by us here at Injury Institute, the best medical lien provider network in California, for your personal injury and workers' comp cases for over 25 years, and our sister organization, the San Diego Injury Network. We'd also like to thank Dr. Khan and Gabe from Extra MRI team for being with us today. Please, Gabe, share more with us before we get into it.
Well, thank you, Audrey, and everybody at Injury Institute. My name is Gabriel, marketing at Expert MRI, California's leading medical diagnostic center, experts in brain, neck, spine, injury, and orthopedic imaging. But before we get started, actually, Dr. Khan wanted us to show a video. Are we ready for that?
I see this light behind you.
Yes, let's see it.
You have this essence behind you. It's amazing, like an angel.
Thank you. It's just the lighting.
So we have an interesting video for our audience to play. Okay, so because it's all relevant to what we're going to be talking about today.
Now I want to race home and go watch that trilogy.
Hope you guys enjoyed that. And without further ado, I'd like to introduce my friend. It has been an honor to assist you as your executive assistant for many years, Dr. Sana Khan.
All right. Wow. So have you seen Lord of the Rings, Audrey?
Of course. Are you kidding me? Every year, practically.
Yeah, well, for those that haven't, it's really amazing. The trilogy is really remarkable. But the reason I actually played that is because you will see as we talk about COVID today, how that analogy of that battle is so true regarding us and all these antigens, these foreign substances attacking our bodies all the time. This war is constantly happening from the time you're born to the time we die. So, but and I will make references to this as we go along. But also, today I'm really hoping that within this hour, you will understand COVID better than you ever had before. And I will spend probably the first 8 or 10 slides regarding the statistics, latest, greatest. After that, you're going to actually learn the science of COVID and what's happening with the vaccines. What's the difference between the different vaccines, and why is something refrigerated under 90 degrees, and why is something needs to be waiting for 4 weeks for a second dose, and things like that, right? So I want to really cover this. Now, feel free to ask the questions in chat, because my generous panelists here, Gabe and Audrey, will be watching the chat. And if there's any questions that are popping up over and over again, they will stop me. Otherwise, I'll finish. And then there are several questions that people have already submitted in anticipation of the talk that I've answered in the PowerPoint in the very end as well. So, but don't be shy to ask questions, and we will get to them. If I don't get to them by any chance, I will definitely try to answer those later on our email or however it goes. Okay, so let's kind of jump into this. So what is coronavirus? Well, you actually probably have heard different names, right? You've heard the coronavirus, you've heard COVID-19, and then less heard of, but also synonym is SARS-CoV-2. So the term coronavirus actually started, and it's been around for a while. This is one of the another mutations of this virus. Because the virus actually looks like a crown, hence the word corona. But then the World Health Organization changed the name to COVID-19. And then it was renamed by the International Committee of Taxonomy of Viruses, SARS-CoV-2. The only reason I'm telling you this is because so that when you hear any of these words or terms, don't get confused. They really mean the same virus. Give you some little data, sad data as it is. We've got 26+ million people that have tested positive. How many cases we've had? More than 400,000 deaths have occurred with this virus, or as an outcome of potentially the virus on top of something else, right? 15 million plus people have recovered. So we've got a 97% recovered rate, about 3% death rate of those that have actually tested positive. So I'll tell you a little bit later on, why the number of people that have been exposed to it actually is significantly higher. So don't let this recovered/death rate fool you. The death rate percentage-wise is significantly smaller than 3%. The recovered rate is significantly higher than the 97%. So just to give you a little bit of, bring it home a little bit for us, the state that has the highest number of active cases currently, this is from yesterday's data, is California. We are once again leading the nation in something. Part of it, of course, is that we have the highest population, and we have currently 1.7 million roughly active cases. But what is of interest is that the number of total cases is 3.2 million, whereas New York had 1.4 million roughly total cases, with active cases at 823. But there's been more deaths in New York than in California from COVID-19 related cases. Now, that is really also of interest. And I know that the local government has gotten a lot of flack for some things here and there. But this data actually is showing that, they've done a reasonably good job compared to other states of controlling this virus and controlling the death. So now that was kind of the bad news, the sad news. The good news is this: we have had in the last 3 weeks a 35% decline in the number of cases, new cases being reported. So that is really, really a good sign, right? Now the number of deaths have not, but they typically lag behind the number of cases being reported, right? So we have seen a pretty large, increase in mid-January, but now, latter part of January, the numbers are coming down. And the good news, follows, because roughly about 100 million Americans have had the virus, okay? So the data actually is that for every person who tests positive, 3 or more have not been diagnosed. the reason is because they never develop symptoms. They get the virus, they're healthy, they fight it off. They don't even know that they ever got it. Although they could potentially be carriers still, right? So everyone still has to be very careful. But if you take this 100 million number plus the about 24 million people that have already been vaccinated, then you are looking at about, roughly 1.25 million. And together, that's about a third of the American population. So we're going to start reaching herd immunity when we reach 50% or more is when you get onto the other side of the curve, right? So good signs. And as the weather gets warmer, which hopefully within the next couple of months it'll get warmer, what we're going to see is, I believe, a very low, like, I wouldn't say COVID-free because we'll never be COVID-19 free. The virus is here to stay, and it's going to be around like the flu virus, has been for centuries, but it will be significantly less effective in terms of the number of deaths it causes. And in the summer, you probably will go back to, I think, normal life. And if we don't want a surge to happen in the fall, we're going to probably have to be somewhere roughly in the 70 to 80% of people having been exposed or hence having developed some immunity or been vaccinated, right? So I'm very hopeful that we have got the worst behind us and we have lots of hope in the near future. Okay, so give you some more data on this. And it's really interesting, about 80%. So like I said, about 75% of people don't even know that they got it. They get it, they fight it off, and they have developed immunity and they move on. Those that actually get symptoms, 80% get mild symptoms. And 80% of those, are just basically told to stay at home, isolate themselves, and they will fight it off. And within, 5 days, 10 days, whatever it might take, they're done with it, right? About 14% are severe enough to get hospitalized of those that are tested, but 5% end up in critical intensive care. And that in itself is a problem because once you get to the ICU, there's a 40 to 50% chance of death, right? Hence our number of 2.5 to 3% death rate. Okay, so I hope that's, by the way, Gabe and Audrey, anytime you guys don't understand something that I'm saying, feel free to stop and say, Dr. Sana, I don't understand this, because if you don't, maybe others don't either. But I just want to make sure that you guys are, it's simple enough so that everybody really kind of.
I will definitely let you know.
These statistics are from all strains or just the original strain?
Okay.
Does it take into account the new?
Very good question. So far, they're from all strains. Okay. Just the total number of cases that have tested positive, regardless of the strain, and it's a good point. And I'll get to the other strains in a few slides. Cool. Different people do different things in terms of masking and protecting themselves. This is one of my favorite doctors in the country, who sent me this picture. I thought it was really funny.
How did he get the doc to keep the mask?
I don't know, but that's his puppy, and he did it, but it was really cute. So I thought I'd show you in terms of, what do you need to do.
I thought I had it difficult with my kids.
Yeah, I have it difficult with you, Gabe. Come on, I don't know the kids. Okay, all right. So let's talk about the risk factors, right? So here's a castle, and these are the risk factors on the outside. Now let me explain what I'm talking about. As we talked about Lord of the Rings, castle attacks, and all that stuff, right? So think of your body as the castle, and if your castle is being attacked by one side, your forces are going to then defend that side, right? That's why you really want to have a castle that has a very narrow opening and has a very narrow area where the enemy can enter from, okay? That's why these castles are typically on hilltops and whatnot, because if you have all sides open, then you're going to be able to get attacked from all sides. That means increased possibility of losing the battle. Same thing happens here. As you get older, right, above age 65, your immune system, your defense forces begins to decline. Okay, risk factor. If there is morbid obesity, because obesity causes a variety of different issues, including hypertension, right, including cardiac disease, vasculature issues. So it's that's a risk factor. If somebody's in a nursing home, why is that a risk factor? Because they're already sick. That's why they're there, and typically older. So that's a problem, right? So you have to make sure, that you're careful with people that are in nursing homes. Diabetes affects your vasculature and other organs. A risk factor. Hypertension, pulmonary disease, cardiac disease. Actually, matter of fact, being a man is a risk factor. Men tend to have these issues more than women
Wait,
do.
so what you're telling me, Dr. Khan, is that COVID is sexist?
Yeah,
That's
yeah, yeah.
that's not fair.
Well, it's actually, I'm sorry, it's not COVID that's sexist, is the fact that men generally tend to be they tend to have more of these other kinds of diseases. And so that's, what happens is when COVID is attacking and you have these other factors, you see the horses attacking from this side. What if that's cardiac disease, right? What if you have pulmonary disease? You're going to have a very difficult time defending your castle. And let me explain that in another way, right? So, and I'm going to talk to you about the lungs a little bit in a few minutes, but why is it that when you have COVID attacking your lungs, that people have difficulty with their hearts? Or why would or why would they have difficulty, if there's cardiac disease available or present? Think about it this way. When the lungs are full of fluid because they're fighting this battle and they've been infected, the ventilation perfusion ratio, which is the amount of air that comes in to how much blood gets perfused with, and the exchange of carbon dioxide and oxygen, is harder. So the body gets the signal because it needs the oxygen. So the tissues from the body give the signal, hey, we need more oxygen. Well, now the heart says, okay, all right, I need to, as it gets a signal, it needs to pump more blood. So if you have a train that's 98% full, right, you need less of those trains. But if it's only 70% full, you need more of those trains to deliver that, coal to that factory. Same thing with the heart. It needs to now deliver more blood because blood is carrying less oxygen because of the problems with the lungs. A normal, healthy heart will say, got this, no problem. And it'll just start pumping faster and more blood. Whereas unhealthy heart will do that too, boom, 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 boom. But after a little bit, it starts to get tired because it is unhealthy already. There's cardiac disease present. So it cannot pump out as much blood anymore because it is tired. Your other tissues in the body, other organs start to suffer because they're not getting enough oxygen. So it's kind of like this domino effect, Audrey, like what you're asking, right? Why is it that? So it's a domino effect. And that's why when you have these other risk factors, it becomes harder to survive. Someone has one risk factor, a problem. If they already have pulmonary lung disease from before, it takes less of the virus to affect your lungs. If you have hypertension and you got your blood vessels are already tight, then you're going to have harder time for the heart to put out that more blood. So all of this is connected to each other. Okay.
And it looks like we have a clarification in chat, Dr. Khan, from Oscar. Yes, some employees in COVID hospitals are reporting 8 out of 10 COVID patients that actually die in hospital. Are there any sources to confirm this?
So there's one thing I could do. Not 8 out of 10 die in the hospital from the data that I have, and my data is coming from CDC and from Johns Hopkins. However, close to 50% of the people that are in ICU when they've been intubated actually end up dying. Okay, still a very high number, but not 8 out of 10 that enter the hospital. Okay, so
can that be true in locations where they're having a big outbreak?
Say again?
Can that be true 8 out of 10 in locations where they have like a big outbreak or like this new strain where it's just kind of going crazy? Do you think?
So the question is an interesting one, because if the system is overwhelmed, if the hospitals are overwhelmed and they can't actually They don't have enough beds in the ICU. They don't have enough equipment to intubate people, to put ventilators on. You could potentially have a lot of people dying just because they're not getting the care that they need, right? But I haven't seen that to be the case here in the US. I know there is in other parts of the world, but that's not a common issue here. And hopefully it won't be as we go further. Another bit of data for you guys is that age is a big factor in who's dying from this disease, okay, from this virus. So if you take the sort of the 25-year-old on the average as the healthy young adult as your comparison group, look what happens at the 65 and above, okay? So hospitalizations, let's just forget that for a moment. Yes, there's higher chance of getting hospitalized, but look at the death rate. Compared to the comparison group, 90 times higher for 65-year-olds, 220 times higher death rate in the 75 to 84, 630 times, not 630%, 630 times higher likelihood of dying than the comparison group. That is why the government has said 65 plus to get vaccinated first, because they're the highest risk. Now, I would have done it a little bit different than the government has done it. I would have said, okay, 85 plus would have been the first batch. So I would have said this first 2 weeks, only 80 years old and plus are going to be allowed to register. And they would have to come in and show their IDs. So 80-year-old plus one person who is their caretaker, okay? Then I would have gone down to 75 to 80 after another week. Then another week to 65, right, to 70. So I would have done it in staggered back to, because once they opened up the 65 and above, this is millions of people. And especially the elderly have a hard time even understanding the computers and how to the heck to get on and make an appointment. And it's really, right? So I would not have done it that way. I would have said anybody that comes with the driver's license or an ID card that is 80 and above, plus one person, they can even have a drive-through shot. Just stay in your car. We'll take the data and we'll give you the shot and you can move on. Because it literally takes 5 seconds to give the shot. Okay. But anyway, I put up the slide so you guys understand why the elderly are in front of the line, because the death rate is significantly higher in the elderly and the survival is much better with the lesser age. So this is what I was telling you about earlier. Gabe, you were asking the question regarding how many people die and stuff. So this is, if you get to the ICU, there's a 41.6% chance of mortality, okay? And God forbid that we ever get to this spot as such. So now we're gonna get into learning what COVID is, okay? You all have probably heard the data that I showed you in some form or the other, in the last year, but you likely have not learned what I'm about to show you, okay? And the reason I'm showing you this is because when you are knowledgeable about something, you will be able to more vigorously defend yourself against that, okay? So we're gonna start off with, and I'm gonna cover all of this. I think I've got another 40 minutes. Yeah, good. We're gonna cover all of this, okay, in 40 minutes. What is a virus? How does a virus attack? What made COVID-19 so dangerous? How does our immune system defend our body? How does COVID-19 attack the lungs and other organs? What are COVID-19 symptoms, durations, and treatment? What does flattening the curve mean? What does viral load mean, and why is it critical to minimize it? Way to decrease viral exposure and viral load. And if one gets COVID, how to isolate yourself? When can you end isolation? What are the long-term sequelae? New COVID-19 mutations and variants, something that Gabe is always worried about, rightfully so, and vaccine overview. And then I'll take questions, or at least go over the submitted questions, depending on the time available, okay? So, and again, feel free in chat if you don't understand something, put it there at least, and we'll definitely get to it. So what is a virus? All right, Audrey, you probably have heard of viruses all your life, right? Right?
Yeah, of course.
Yes. But what is a virus?
Oh dear. Well, can I read off the screen, or is that
No.
not allowed?
So the thing is, Understand, right? We are all exposed to viruses all the time, and yet we don't really know what a virus is. So within the next 30 seconds, you guys are going to know what a virus is. Okay. I mean, superficially speaking. So what's interesting is a virus is actually not a living structure. It it really needs to be inside of another cell in order to replicate. It needs to be inside of another cell of another organism. Okay, it cannot replicate on its own. So it's a non-living complex molecule. Okay, doesn't have a heart, doesn't have lungs, doesn't have any of that stuff. Okay, and it's so it's surrounded by this protein coating, and this is a coronavirus, right? So you can see that there's a protein coating around it, and then it has these receptor or these what do we call epitopes, right? These are its markers on the outside, and it carries within it an RNA or DNA, and this is genetic material. It's basically coding material that allows for itself to replicate. That's the code through which it replicates itself by inserting its code into another host. Okay, so it's really brilliant. I have to tell you, I don't even know how to explain this, but the what a virus does is brilliant and it has no brain. No, so now, compared to bacteria, because bacteria can replicate themselves on their own, uh, it's 20 times smaller to sometimes, 100 times smaller. So it's a very small, tiny little size. So compared to the E. coli, it's about 20 times, the COVID-19 virus is about 20 times smaller than E. coli bacteria. And just to give you some comparison, it's about 10,000 times smaller than a grain of rice. Okay. So very, very tiny little things. This is what it is right now under the microscope. It looks it looks, if you look at pictures of coronaviruses, it looks really like cool and sexy and all that. But if you look at it under a microscope, it doesn't really look all that hot. So yeah, it's not as pretty as they make it look like. So viruses, we are all exposed to all the time. We're very familiar with them from a perspective of being exposed to them. And, we have, we catch the cold, right? We catch the flu. This thing, oh, I got the flu. You don't really think about a virus, right? But viruses can affect all the different kinds of organs, right? So for the brain, they can cause something called encephalitis, meningitis. You probably have gotten meningitis shots already if you've traveled. Then it can actually, affect the pharynx in the back where the airway is. That's why you get all these sore throats. There you get the herpes simplex type 1 that gives you the mouth sores. Anyway, on and so forth. It can affect the lungs, causing pneumonia. It can affect the heart, causing cardiovascular disease. Livers, it can cause hepatitis. You probably have heard of hepatitis A, B, C, and all that. They're all viruses that affect. Okay, you can actually get gastroenteritis with a lot of these viruses. So I'm kind of giving you an idea of how common it is in our world. Right now, everybody's just COVID-19 freaked out, but lots of viruses around everywhere. So how does this little tricky thing work? Okay, so what happens is viruses are coming to our bodies all the time, but it's viruses, right? Bacteria, and you got fungi and other organisms that are attacking us all the time, just like in the movie. And our defense systems, our castle, blocks them off and fights it off. Well, so a virus, when it actually comes into the body, our immune system recognizes it. It takes a little bit of time if it's a new virus, but it recognizes it, identifies it, and I'll show you in a minute how it basically destroys it. Now, when it comes to a virus that becomes infectious, what happens is that virus has this epitope that it comes into the body, and all of a sudden it gets to a cell that it recognizes, saying, aha, my key fits this receptor.
Wait, did you say epitope? I've never heard of that before.
Yeah, so that's the outside, like this is like the outside of the virus it's an epitope. It's like its marker, it's covering. Okay.
So we got a quick question, since you're on the slide where the cell attaches itself to the virus attaches to the cell. So Moses is asking, does melatonin prevent COVID-19 virus from attaching to the cell?
Melatonin itself?
Mm-hmm.
No. So by the way, melatonin actually kind of helps you rest and sleep. I don't know if know about that or not, right? I don't know the exact mechanism, but I can tell you that resting in itself will help you against this virus. Okay. And that's because your body needs all the energy to fight off these infections. Okay. But make a note of it, Gabe, and I'll see if I can get back to Moses on that, because I don't know the exact answer for how melatonin's function works, but I have heard that it helps. Okay. So getting back to the key and the lock in the key. So here's your receptor. Here's the key. So all of a sudden, COVID-2 or SARS-CoV-2 says, aha, I know this, but you know what this is? It happened to get locked into a receptor called the ACE2 receptor. That's an enzyme called angiotensin converting enzyme 2, and it's a protein on the surface of many, many cells. That's the problem. Because this virus key attaches to this receptor, to this door, that's a very common door on many, many cells, and it's on the so the ACE2 receptor is in the nasal mucosa, it's in the mouth, it's in the lungs, it has heart, it's in the blood vessels, kidney, liver, GI tract. So you can see why this virus is such a problem. It has a key to the entry to the cells of all these organs. Okay, so, and it's a novel virus, meaning our body hadn't seen this type of mutation that would actually affect the ACE2 receptors as such. So what happens is this: the virus, knock knock, they recognize it. Oh, this receptor is good. So there's something called there's an enzyme, PMPRSS2, which is like your soldier that stands at the gate, recognizes that, aha, this is the entrance key. I agree. Opens the door by mistake. I mean, not by mistake, but that's the signal it got. This is the secret knock. Let him in. Then the virus gets inside because of that. Once it's inside, it actually then releases its RNA that's sitting in here. Okay. Remember, I told you that's the code, the coding sequence. Okay. That coding sequence then utilizes the machinery of the cell and takes it over and then replicates itself. Okay, so this RNA utilizes the machinery, the factory of the cell to make more of itself. Then it goes into this factory called the Golgi apparatus, which then packages it and then envelopes the RNA, packages, and then now it's formed, then it gets exported out. Okay, now, depending on the number of viruses coming in, this process, this export is happening, but sometimes this production can become so fast because there's so many virus particles inside that it can actually burst the cell. And once it does that, now you have a whole bunch of viral particles instead of one, a whole bunch of them now being exposed, that tissue being exposed to it, that organ being exposed to it. Okay, that's why mounting an early response is very, very important for the body. The longer it takes to mount a response, the more of this process can happen. And the virus can actually become, can overwhelm the immune system and your body and leading to all kinds of problems, right? So that's kind of like what a virus does, how it gets to the cell, how it replicates itself, packages, but uses a factory to package and then gets released out or makes so much that it bursts the cell. This is an absolutely amazing enemy.
Okay. Sir, we have a good question from Oscar. He pointed out that in situations where the COVID virus attaches to the iron protein, causing a blood clot, because it's, you know, how it's replicating itself. Is this something similar to what we're talking about right now?
Yeah. So what it does, it actually, so in the vessels, it does that. But the main thing that really happens is the inflammation of the vessels. Mm-hmm. So you may have heard this, that people that have COVID will tell you that my brain was foggy. It was not functioning. I couldn't really think properly. I was just kind of weird, this haziness.
Like COVID brain fog?
COVID brain fog. But COVID brain fog, Oscar, is not from COVID infecting the brain cells. It actually is affecting the vasculature that's supplying blood supply to the brain cells. Okay? So what happens is these folks start to get this haziness, and also, in fact, maybe even stroke-like symptoms. Because if they have vascular disease to begin with, and the vasculature gets compromised, as you were pointing out, um, it's going to stop the blood flow to that area of the brain. And in fact, when that happens, you can have cell death of the brain cells, right? So that's why it's important to really have a very strong immune system, but not have all of these other comorbidity factors. Okay. Now back to the castle. Okay, and back to Lord of the Rings. So your immune system actually protects against invaders. Okay. Now you have barriers, right? Remember, this castle has this wall outside. Well, that barrier really in us as human beings is our skin, right? It prevents invasion right off the top. So virus can sit on a skin, but if it doesn't break through, it's not going to do anything. Okay, because they can shoot arrows at the wall, but it's not going to do anything, right, from the outside. So what happens is that then if they do start to come inside, you have this second level, right? You have these soldiers. They're the cells and the chemicals. They try to stop the invaders. They're shooting arrows at them. They're throwing rocks at them and all that kind of stuff at the invaders. Then you have this third level of really powerful warriors in your blood. Okay, these are your warrior immune cells. That's the adaptive response. So you have a barrier response, you have the innate, all these macrophages going around all the time, and then you have this adaptive, meaning like you have these powerful cells that are formed against an attack of these type of soldiers, and they're the mean guys. How mean are they? This is what they look like. These are the good guys, by the way. These are the big bad boys in our bodies who are eating up these bad blue tagged cells. But let me tell you, let me start up on top before I go there. So remember I told you our bodies being attacked by viruses, fungi, toxins, right? Pollution, parasites, bacteria, all this stuff is coming in, and our immune system is recognizing it and removing it. I'm just going to give you in a very simplistic way without going into too much biology, but you're going to understand what happens. So we have something called B cells in our body. Okay, they're floating around, and well, they're floating and say, this doesn't fit, this doesn't fit. Aha, here's a foreign body. Now this is a bacteria in this case. At least it could be labeled as a bacteria or virus. It doesn't really matter. It's an antigen. Wait, I recognize this as a foreign body, and my arm fits, my hook fits, right? They all have unique shaped hooks. Not every cell will fit the hook of this cell, of this bacteria. So as soon as the B cell recognizes a foreign body and the fact that it has that hook that holds on to it, it immediately activates a T cell. Says, the signals go out, beep, 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 right? T cell hears it, the helper T cell, and says, aha, hey, listen, buddy, you caught somebody. Gotcha, man. All right, you know what? Let's replicate you. So what the helper T cell does, as it gets activated, it activates the B cell to start dividing into two and multiplying. Okay. One of the types of cells that the B cell forms is something called plasma cell. And I'll show you in a minute what that does. The other is a memory cell. The memory cell division basically makes you immune for long term. Why? Because now instead of one B cell with this hook, you got 1 million in your body now looking around for bacteria like this. That's why if that bacteria puppy ever gets in anywhere, instead of, one of these guys searching for it all over the body, you got, 1 million of them searching for it all over. And says, aha, gotcha, buddy. You ain't going nowhere, right? Out. We're going to knock you out. So how do they knock you out? This is what they do. So now what the plasma cell does, remember 2 parts, there's memory, it's floating around, but then the plasma ones, what they do is they actually produce something called antibodies. You guys have heard of that, right? There's antibody responses, there are antibodies. They produce these antibodies, and what these antibodies are these little hooks. Remember the hook that it attached on? They produce these hooks that attach on to any of these bacteria, any of these antigens, okay? And they'll produce millions and millions of these hooks. So when you have an active infection going on, all of a sudden your plasma cells are creating these antibodies, go all over your body. They attach themselves to this enemy, And then guess what happens? You see this blue tag? Blue tag? I want you to look down here. There's a blue tag here on this soldier. Okay? These antibodies will tag this. And once they have tagged it, now we have macrophages, our big eating, mean eating cells that say, aha, there's an antibody attached to you. Puppy, I got you. And it'll eat it up, all kind of chemical reactions, and start knocking them out, knocking them out. Okay?
Wait, so I'm a little confused because I've always heard that it was white blood cells that like attack the bacteria.
Yeah, these are white blood cells. Yeah,
Oh,
yeah.
they are. Okay.
Yeah.
It's just
I'm just showing them in a mean, crazy, bad,
Gotcha.
understandable way. Here it is to your right. You see this top right? There's a that's your white blood cell, the mean one.
Gotcha.
Okay. All right. So I'm just trying to keep it also fun for you guys so you understand it, So here's a memory cell, right? It says, I remember this one, okay? Right? I told you now, because so many of these got created up here, anytime this guy comes in the life of this person, you have all these guys floating around, and now it recognizes it, says, I remember you, you're not one of us. And it starts this response, okay? So that's how your immune system kind of works, right? I mean, again, I hope that's understandable. If it's not, two of you or my feedback, let me know. Okay, now, what you want is, therefore, your army to be the strongest, right? You want to have the best, strongest army, which is your immune system with all these cells. Well, what weakens it? Well, stress weakens your immune system. Alcohol, lack of sleep, right? I think Moises was asking about melatonin and how does it help, right? Melatonin helps you actually sleep, okay? It helps your immune system. That's immediately off the top of my head, I can think of that benefit. Unhealthy diet, dehydration, lack of exercise, smoking, right? All of this harms your immune system, okay? Now, as you get older, the immune system automatically starts to get weaker anyway. So you got to make sure that you do, you stay away from these things and try to make your immune system as strong as you can. The problem with COVID and with all our lockdowns is that, honestly, the problem, people are drinking more because they're home more, right? A lot of people are just staying home and watching TV, and the diet is horrible, not exercising, the gyms are all closed, okay? Of course, I don't know about the smoking part, but stress and anxiety, all of this is circular because all of this weakens our immune system, and they were more vulnerable to COVID-19. So, or any other antigen for that matter, or enemy. Tips to strengthen your immune system. You guys all know this stuff, but I'm just telling you anyway. Eat fruits, vegetables, get sunlight, lots of water. I think this was meditation. Sorry, but I better change that. I put mediation because I always think of lawyers all the time, I guess. Multivitamins. Audrey, you have this perplexed look. I misspelled meditation into mediation. So.
Oh my goodness, I didn't even know I was sharing my screen.
Yeah.
I've been found.
Multivitamins, right? Get enough sleep and exercise. So help your immune system do better. So coronavirus, what happens to people's lungs when they get COVID-19, and why the lungs to begin with, right? So I'll tell you, the mode of transmission is with airways, right? So what happens is when somebody coughs or sneezes or you touch a surface that has virus on it. By the way, so virus cannot live, cannot replicate on its own. It can live on its own for roughly about 3 days. Okay, so that's why surfaces and stuff have to be disinfected, so that if there is virus on there and you touched it, we touch our faces hundreds of times a day, our hands, our nose, our mouth, our eyes, rubbing them, and the virus can enter through that way. But the most common mode of entry for COVID-19 is through the airways. That's why the masks and all this stuff, and I'll explain that in just a little bit also. What happens in your lung with COVID-19? Now, please do not get freaked out by this slide, okay? There's a lot of information. By the way, you may have noticed if you've been to any of my lectures, I give a lot of information on the slides, but I talk through them rather than read, because I want you to be able to, in case you find this slide to be interesting, go back and read through and understand what the slide is saying on your own if you didn't capture it while I was talking to you. Okay, so let's walk through this a little bit. This is your lung. Look at this onto the left side, right? And then your lung has, these airways that are coming in and going out, right? And so these airways, if you go down further and further and further out to the very tips, they actually at the very end will form these sacs called alveoli. And it's at the alveoli where the blood air exchange happens. Okay, that's where oxygen is brought into the tissue. Look to my middle here, right here. This is the alveoli air sac. Air comes in, blood capillaries are right there, very, very thin levels, right? Cellular levels. And there's an exchange of carbon dioxide given out by the blood, oxygen being given into the blood, and off we go. And this process keeps happening, and your body is happy campers because they're getting nice oxygen, and that's necessary for a whole bunch of other reactions and stuff. So that's a healthy alveoli. Okay. Now,
So we have another question from Maria. She's asking, can this virus be transmitted via blood transfusion?
oh, very, very good question. And I will tell you that the likelihood is pretty high, right? I mean, in other words, if it's infected blood, that is. Okay? Because it is certainly circulating in the blood as well. Um, so if that was the only mode of its transmission, we would easily capture, we would, right? We would easily capture it, but it's not. It is, but the main mode of transmission is through the airways. Now, what happens here is this. Now, this is why people get short of breath and have difficulty. Now, in this alveoli, there's two types of cells, okay? Type 1 is basically there for the oxygen exchange, okay? Type 2 produces something called surfactant, okay? Surfactant is this fluid that lines the alveoli and keeps it open, prevents it from collapsing on itself, okay? Remember, this is kind of like a balloon, right? It needs tension to stay open. So when the air is being brought in, it expands. When the air is being pushed out, it closes, right? Pushes the air out, but then it needs to keep its tension to be able to expand again, okay? So this is the problem. This type 2 cells actually have the ACE2 receptors. Remember the ACE2 receptors I was telling you about? That's the doorway, that's the receptor that COVID-19 has the key for. So it has the key for this cell's receptor, okay? Now what happens is that as the virus gets into this cell, okay, it's going to then cause problems. What is going to happen is the type 2 cell that got infected releases help signals, okay? And it recruits what we call these macrophages. These are our cells that attack and kill. Well, macrophages, they need access to that cell. They need access to that area in order to be able to combat the virus. Well, naturally, what they do is release something called cytokines. And you may have heard of the term cytokine storm, maybe you haven't, but when these cytokines, what they do is they basically open up the vessels so more of these macrophages can come through. But because these vessels open up, fluid accumulates here, okay? Because blood has fluid, right? So macrophages are coming in, but there's fluid being accumulated, and there's a reaction within the cell as well, right? The immune system is now knocking the stuff out, but there's fluid being accumulated. So you can only imagine this. Look up here.
Is that fluid mainly plasma, or what's in that fluid?
Yeah. It's plasma. It's immune cells, right? So it's really your own body's fluid, okay? Right? So you got all kinds of stuff going on. You got neutrophils coming in. You got macrophages coming in. You got plasma, and as the fight happens, right? As the blood is, you're going to have almost this pus-like formation. We create this protein-rich fluid from this fight. So look at the problem we have here. You see this distance here? Audrey, can you see that, right? See this distance? Okay.
Yeah.
Look
Mhm.
at this distance up here in a healthy cell. Very easy exchange, right? Now you got fluid inside the alveoli and you got fluid outside. This exchange of oxygen with the blood, with carbon dioxide exchange, this is affected now. And people start to feel short of breath because their tissue is not getting enough oxygen because of the hurdles. The more the alveoli are infected, right, the more this problem, the more this issue happens, the less oxygen comes into the body. The less oxygen comes to the body demands it, the heart has to comply, but if the heart is diseased, it's not going to be able to sustain, right? So that's why. So keep in mind what I'm telling you right now when I start talking about um, flattening the curve and when I start talking about making sure that your viral load is low. Okay. So that so far so good. Do you understand kind of what's happening, right? Alveoli, bloodstream, this cell gets infected, the fight starts, causes lots of fluid, makes it very difficult for the exchange to happen. And the more of these cells that get infected, the harder it is for the lung to breathe normally, and the harder it is, and the less oxygen carbon dioxide exchange, the less the rest of the body is getting oxygen, and it can really cause big problems. And if it's severe enough, it can cause really an inflammatory response syndrome or acute respiratory distress syndrome. Okay,
I was already afraid of drowning, and this isn't helping, Dr. Khan.
well,
Or,
this is not that dissimilar to drowning too, because if you get all this fluid in your
yeah.
lungs, that water exchange, that oxygen carbon dioxide exchange is going to be affected. So in a way, I know, you're afraid of it and you're kind of making a joke, but in a way, this is drowning of the lungs, but internally, instead of water coming in, it's fluid being produced internally. Okay, so now, I told you that the ACE2 receptors happen to be in lots of different organs. That is why we have all these organs. It's a multi-organ injury with COVID-19. Okay, that is why it's causing so much trouble in our world of today. Um, so common symptoms: fever, dry cough, shortness of breath, right? Fatigue. Again, fatigue also comes in from the fact that you're not getting enough oxygen into your body, right? Anyway, you can read this on your own. Uncommon symptoms are here to the right with headaches and diarrhea and sore throat and stuff. Complications are listed here: acute respiratory distress syndrome, um, septic shock, and blah blah blah, right? Acute cardiac injury. So I don't want to belabor too much. Hope you guys you're happy to give you the slides so you can read it on your own. Let's talk about symptoms and duration. So when you have the infection, once the virus comes in, okay, this is the problem. The stupid thing this is incubation period. While you can be infectious, not even knowing that you have been infected by it. So the virus comes in, incubates for a couple of days, okay? And then if your body hasn't knocked it out over here, remember I told you almost 70% of the people knock it out over here, okay? The issue is this: even when they're knocking it out, they could potentially be infectious. So that's why, because it's a novel virus, it takes longer for us to knock it out. Remember, our immune system hasn't seen it before. Had it seen it before, the B memory cells, lots of them around, would have recognized it. Said, gotcha, sucker, right?
They
You are
would have
not
had
going
the
anywhere.
key already.
Exactly, right? All these antibodies would be in the body. You would have recognized it. You would have caught it right over here and knocked it out early. If you knock it out early, even if somebody has cardiac disease, diabetes, whatever, those organs didn't get affected, right? Because even if the heart had to work longer for a little while, not a big deal. You could handle it, but don't ask it to work 5, 6 days in a row. Maybe it can work harder for 1 or 2 days, but then after that, it's going to just get really tired, right? So that's the problem with this. It's a novel virus. We haven't seen it, so it takes longer for the response to happen. The B cells aren't prepared just yet. That's why the vaccines are important, right? It actually gives you that recognition in your body without infecting it. So anytime This virus comes in now, it's going to face an army that's already ready for it. Okay. So after day 2, 3, 4, whenever it is, the symptoms onset, this is when the patient is highly infectious from 0 to 5 days from the days of when the symptoms started. Got it? Okay. So then typically somebody who basically fights it off on their own after 5 days of symptoms will start to really taper down. About 10 days go by and you're going to be okay. 12, 13 days, you're all right. But however, don't get fooled, because lots of people continue to test positive for COVID-19 even after 3 months. Okay, but the PCR test is doing is actually looking for parts of this virus, and you may still have parts of this virus hanging on for a long period of time. So you may still test positive, even though you're not, you're post-infectious, and so that's tricky. Also, doesn't mean that if you are out here that your body still doesn't hurt and you still don't have certain, continuous, very continued symptomatology from it. Because if it affected your lungs enough, then you're going to continue feeling that shortness of breath, even though there's no more infection over there. But fights, wars cause damage, and your organs can actually get damaged from the war. Okay, even though the enemy is no longer present there.
Post-infection, how long does the vaccine last? I mean, sorry, the immunity last?
So we don't know the answer to that question just yet with COVID-19 vaccines. And that's why you have this thing of when people are saying, well, gosh, I'm not going to take it. We don't have any history. We don't know what this is going to do. What's the long-term consequences and all that. And I always look at it and say, listen, risk-benefit ratio, right? Yeah. If you're really the elderly, I absolutely told my parents to get the vaccine. My mom is 78, my dad is 82. So
there's another, regarding the blood, you're saying you could potentially contract the disease. There is a way to treat it with the convalescent plasma.
Yeah.
Yes. What are your thoughts on that and compared to a vaccine?
No, it makes sense, right? Because if somebody already had it, if you take their plasma, obviously they have to have matching blood types.
Yeah, of course.
The blood type, because their plasma is carrying the antibodies to the virus, right? Makes sense. Right. But how many people are you going to do that? That cannot be your cure in the society, right? You can't keep doing, plasma infusions into people as your line of defense. However, if somebody does have it and they're in hospital, then that infusion could help. Now, again, the reason I keep saying could and we don't know is because in science, typically, we do research over years before we say for certain we believe this to be true. We have not had that luxury with COVID-19 and with this pandemic. So a lot of things the answer is, I don't know. What's the long-term consequences? I don't know. But yeah.
Is there any risk factor with going with the convalescent plasma treatment, given that you can get reinfected through the virus being in the blood?
So what they do is they will, of course, screen for that, right? So they're going to screen, because it's very easy for us to screen for the virus. You can actually do in the lab, easily will detect it. So they're not going to give somebody plasma if they have active virus within their system, right? So
it's pretty safe.
Yeah, it's pretty safe. So I'm not going to go through all the medications with you guys. Just I've made this slide so that you have a sense about it and what they do and how they work. And this
before you move on from the medications, somebody asked if there are any things from the vaccine that we need to worry about, like any adverse effects.
Yeah, I'm going to get to that.
Okay.
Good question. It's coming up. Okay. Now, a very important graph. Gabe, have you heard of the term flattening the curve?
I have, sir.
Okay. Do you understand what that means?
Yes. We will have the same amount of infections, but we want to spread it out. So that way we don't.
All right. Very good.
Our hospitals.
See, Audrey, how smart he is? Okay. So a lot of people don't understand the concept, and which is okay, but let me explain this very quickly to you. COVID-19 is here to stay. It's not going anywhere. Okay, it's going to be around for God knows what, just like the flu virus or any other virus. Okay, you'll have different variants, but so let's just say that you have 1 million people in a population. Okay, and we're going to say that all million are going to get exposed to COVID-19. What you don't want is that million to get exposed within 2 months. What you would rather have is to get them exposed over 2 years. Because if you have 1 million that gets exposed, let me use it better. Let's just say that 2 million population, you don't want the 2 million to get exposed in 2 months. You want the 2 million to get exposed over 2 years. Because if you have, let's just say 1 million of them that are exposed and the curve is really sharp, what that means is the other million are going to have a lot of people that they're going to get exposed to, and that curve keeps rising. Okay, does that make sense? So what you want is, well, not what you want, but what's going to happen is try to lower, flatten the curve, less people at a time being exposed to the virus.
So where between these two projections do you think we lie? Are we more towards uncontrolled transmission in California, or what do you think?
Well, so yeah, we were for a little while.
Yeah.
Okay, and that's why the lockdowns. That's why, because they almost had to kind of force everybody to be in a lockdown in order to flatten the curve, because our hospital systems are not able to handle that many patients at a time. And keep in mind, we're not just talking about COVID-19 patients, right? Hospitals handle heart attacks and strokes and cancers and all, the ER is handling a variety of different emergencies, broken bones and broken necks and car accidents. If the system gets overwhelmed, see Audrey right here, if you have this many people, our healthcare system, our ICU beds, if they're here, first of all, they're not going to be able to handle the COVID people. At the same time, what about all the other emergencies that we all go through as a humanity? That is why wearing the mask, that is why keeping the distance, well, that's why slowing things down so we can keep this flattened as best we can over time, so that the systems don't get overwhelmed. And people don't die because they don't have access to the ER or to the beds in the hospital. Okay, so flattening the curve simply means lowering the number of people at any one given time that have the infection from the pandemic causing virus. Okay, this has got to be the most important slide of this presentation, and it's the concept of viral loading. Audrey, have you heard of this before? Have you heard the concept of what viral loading, the term?
I have, but I can't give you the definition.
Good. Okay, but I'm glad that you said that, because this is very common answer from people. They don't understand what viral load actually means and why do we do what we do. Okay, so remember, back to the castle. Let's look to the right. Okay, now what is the enemy trying to do? They're trying to break down a wall. Why? With all those big boulders coming at it, right? Well, because let's just say there's only a narrow entrance. They can't, like, they send in 200 soldiers. Well, you got 2,000. You can knock out those 200 easy peasy. But if the enemy can knock down a wall and bring in 1,000 soldiers at a time, and they have 10,000, you got two, well, your 2,000 will still fight off the 1,000, but you're going to have casualties. Got it? So the viral load, the load of the number of opposite soldiers coming in is absolutely mission critical. If you have small number coming in, it's an advantage for you because you capture them, you get them to tell them their secrets. How do they communicate? What's their plan of attack? Who are the guys, right? You capture them and you got it. So if your immune system can capture a small amount of the virus, it will know what to do and it won't get overwhelmed. But if you have too much of a viral load coming into your body, too many of these enemy soldiers coming in at any given time, your immune system may not be able to respond as fast because it's a novel virus, and that virus gets to replicate a lot faster than the immune system actually could respond. And that viral load will cause the symptoms to occur. So that's why you have about 70% of the people that get no symptoms at all, because they're getting exposed to someone who gives them a little bit of the virus. Now, how can that be? So if a person is wearing a mask and they cough, Well, the big droplets of that cough or that sneeze will get blocked by the mask. Yes, the small particles are still too small for the mask to block. So you have the small particles will still go. But the recipient, the viral load on the recipient is going to be significantly less if the person who's giving it is wearing a mask. Okay? Because each droplet is going to have millions of viruses. So now if both people are wearing a mask, then the droplets, even if some droplets get to the other person that land their mask, that droplet doesn't get to come in, your viral load is significantly smaller. So the argument people make is that, hey, listen, these masks are, they're not, the holes in them are not small enough to stop the virus. You need a surgical mask for that. That's a correct argument. But what you're not trying to stop the tiny virus particles coming in. You're trying to block those big boulders coming in and knocking down your wall. That's why you should wear the mask. Social distancing. Why is that important? Because the longer the distance the virus has to travel, the less of its particles, less viral load on the recipient. Okay, the less load they get, the better chance of their immune system to capture them, more, get the immune response going, and figure them out and become immune to the virus. Okay.
So what you're saying is most of us have probably already been exposed, but since the viral load has been low, by washing hands and social distancing, it just hasn't taken, wow,
Yeah,
scary thought that it has actually been inside of us.
Well, so, I remember the other day we were talking to Steve Artizarian, and Steve was saying that people in his house got sick and he didn't get sick, and he was all proud of it, that he was Mr. Macho, right?
Mm-hmm.
Right. And what I told him was, Steve, I am very certain that you were already exposed to it.
Yeah.
And you had the
antibody. Not right, living together. It's just impossible.
Right. Because you were living in the family with your wife and kids got it, and you didn't get it. And it has I would bet money on it that he already got it and has been exposed to it and had antibodies already in place. You don't necessarily have to detect. Sometimes you can actually even do an antibody test and not find the virus, not find the antibodies. It doesn't mean that you don't have it. Okay, the tests are not perfect. So, nice. Got it? Dave, you understand viral loading? Audrey, do you understand the concept of minimizing the viral load to your body?
I got it, but I'm not happy about it.
Well, you should be, because at least now you know why you should wear a mask. Now you know why other people around you should wear a mask.
And so you think the face shield is not preferred? The mask is.
Face shield.
Does it still be the sides, right, where you could get the?
My preference is the mask over the face shield.
Mm-hmm.
Okay, but it still will protect face shield will protect the big droplets. Okay, so anyway, again, if you decrease the viral load on yourself, it actually is the best way to get immunized, really. So, but you don't know who's got it, who's giving it, who's not. So wear a mask, ask people around you to wear a mask, and do the best you can and keep a safe distance. Okay. How to slow the spread of COVID-19. All right. I think we're going overtime. Sorry.
You forgot to keep a positive outlook, sir, on that slide.
Yeah, people haven't left yet, so I'll keep going. So wash your hands, right? Stay the 6 feet distance, because again, less virus comes to you, the better chance you have of not getting the disease. Wear a face covering, right? If sick, get tested and stay home. Okay. Avoid touching your eyes, nose, and mouths, because the virus can actually, we're the biggest reasons we give ourselves viruses, because they're on the surfaces. We touch surfaces, we open handles, right? And then we're rubbing our eyes with our hands. So avoid touching your eyes and nose and all that stuff. Clean and disinfect, and you're going to slow the spread. You're going to flatten the curve. You're going to help society and humanity. Even if you're young and you're not in that vulnerable zone of dying from it, you don't really want the virus. You don't know what the long-term consequences, we don't know what the long-term consequences are. And in fact, even if there are no long-term consequences because you're young, think about your parents and your aunts and uncles and those that are elderly that you may give them, and you don't want to be in that position. Okay. So lowest risk, home alone or with housemates. Okay. Lowest risk. Moderate risk is outdoor activities. So, when you're having outdoor sports, when you're doing outdoor stuff, moderate, really, it's really not very much because the virus will actually dissipate. The problem is when you're indoor, it's when you have air circulation, air conditioning, that is going to take the air and kind of bring it right back in a cooled way. And it's going to, so the virus will keep recirculating in indoor. That's why really the indoor activities of a large number of gatherings should be minimized. Okay. So you don't increase the viral load onto each other. Can kids catch coronavirus? What do we know about COVID-19 in children? Okay. So more than 1 million kids have been diagnosed with COVID-19, but it's not getting much attention. Well, why is it not getting more attention? Well, because severe illness with COVID-19 is really rare in children because the kids actually have very healthy organs. They have the ability to take that couple of days of punches from the virus, and their vessels are really good, their lungs are typically healthy, their heart, so they have low vulnerability of severe disease from this. Okay, so that's why you don't hear much about it. But of course, kids are kids, right? They catch cold at school and they catch COVID-19 potentially. Now, that's not the end of it though. You have to keep in mind the kids have other issues that are going on, right? There's family stresses and mental health. We have a lot of people out of jobs and they're at home, and the fathers are upset and the mothers are upset, and then there's stresses, and that passes down to the kids, right? You have disruption of education. You have reduced access to healthcare because parents don't want to take their kids to the pediatrician or like they would normally, right? There has been increased child abuse. So domestic violence has actually increased.
Oh, that's sad.
So it's very sad, right? So even though the kids are not being affected directly in terms of being sick severely, there's still other issues they're facing. So what happens if somebody in your household gets COVID-19 currently? Okay, I do believe that within the next couple of months, those who want to get vaccinated will get vaccinated, and by this summer, we're going to be fine. So, but until then, what do we need to do? So dedicate one room for the affected individual, and hopefully there's an attached bathroom with that. Okay, they should eat or be fed in their room if possible. Try to use non-disposable food service items. Handle with gloves, right? Wash with water or with dishwasher, and clean hands after handling any used food service items. Um, you know, dedicated linen trash can for the ill person. Use gloves when removing the garbage. Just decrease your viral load potential from that person. Okay, and I told you from the day of infection, the highest infection rate is the day of symptoms to 5 days is where they're the most infectious. Okay, but like I said, until they have recovered, don't or try to minimize your exposure to those folks. Now, recovered from COVID, when can I meet people? This is one of the questions I was getting repeatedly. Right? So here's the answer. According to the CDC, at least 10 days after recovery. Okay, I'm sorry, from the symptoms. So at least, really, typically after 5 days of recovery, I would give myself at least that much. Okay, if you have 24 hours with no fever, without fever reduction medication, so don't take Tylenol and say, okay, I'm fine. You should be no medication. So I'm going to say again, 10 days since the symptoms first appeared, and 24 hours with no fever, without medication, and other symptoms of COVID-19 are improving. If you have loss of taste, smell, right? So make sure that these three things are happening before you start to meet other people. So complications and long-term sequelae. So people that got severely ill, 53% continue to complain of fatigue, shortness of breath, 43%, 27% talk about joint pain, 22% chest pain. And this is about 30 days post sequelae, okay? Patients with milder initial infections, 43% continue complaining of persistent cough for several weeks afterwards. 35% complained of fatigue. Fever and chills persisted in only 3 or 4% of the people. So just for FYI. This is Gabe's favorite question. Mutations, okay? What do we do about them? There's not a lot you can do about it. That's why I'm saying continue being vigilant in viral load minimization, okay? There's already been a more contagious variant identified in the UK. And at least 4 US states and 33 countries have identified new variants. The new variant from the UK is called B11.7. Don't worry about learning that. I will not be giving you a quiz on it. But additional variants will happen. And there's just not a heck of a whole lot that we can do. The vaccines should protect us from these variants unless there's some big mutation. So I think that'll be helpful. But like I said, COVID-19 is here to stay. Let's talk about vaccines. How do they compare? This is another question I kept getting. I'm going to focus more on Moderna and Pfizer, but there are other vaccines that are out. So the Moderna vaccine actually and Pfizer have gotten emergency approval from the FDA. So Moderna efficacy is about 94%, and the Pfizer efficacy is about 95%. Which is extremely high. We normally are very happy with 50, 60%. So this is a good sign. The Moderna vaccine requires 2 doses, as does the Pfizer vaccine. Moderna is 28 days apart. Pfizer is 21 days apart. The big difference is in storage. Pfizer has to be at negative 70 degrees Celsius, whereas Moderna can be at normal refrigerator temperatures.
I remember watching the 60 Minutes special, and they said something about like a non-freeze, non-refrigerated vaccine. Is that still in the works, or is that completely off the table now?
Well, no, I mean, it's not completely off the table, but if you look at each one that's in the works right now, so these other 4 are still happening. They're still at a, sort of a 2 to 8 degrees Celsius, right? Still cold, like refrigerator. So, but once they are, I mean, obviously they have to be thawed out. They have to be, warmed up before they're given. So, again, study that slide on your own. Pfizer versus Moderna. Moderna was actually approved for 18 and older, while Pfizer was permitted for 16 years old and older. Those are just the numbers they chose to do the studies on. Pfizer vaccine is 95% effective, Moderna is 94%, Pfizer 21 days, Moderna is 28 days for the second dose, and different temperatures, right? So let me tell you something interesting. Then this question kept coming up, and the question of 1 dose versus 2 doses, right? So for Pfizer, it's interesting because they have, in their limited experiment or experience, the first dose is about 50% effective level, okay? Moderna, on the other hand, after the first dose, is 85 to 90% effective, okay? Keep in mind that most of you will receive Moderna, and the reason is because having negative 70 degrees Celsius temperature is very difficult in the common setting. So hospitals will be giving primarily the Pfizer vaccine, whereas the outside vaccines are going to be primarily Moderna. And in some ways, it's better, although, you have to wait 4 weeks for the second dose, but that'll get you up to about close to 94, 95% effectiveness. Okay. So that's the end of that. I have more questions that people had questions. I can go through those, or do you have anything specific that you guys have to ask?
Yes, we have one question where they're asking, in situations where there's a severe case, will getting the vaccine at that point help?
No.
Because you need that long term to build those antibodies.
Well, your body's already started recognizing.
Right. Oh, it's already started that process. Mm-hmm. I have another one. We are all now kind of concentrating on the initial impact, but for the long-term effects, what diagnostic tools should we be utilizing to document those?
Wow. Okay. So as I told you, the primary organ that's get affected is the lungs. We have developed an entire protocol for doing CT scans of the lungs, so we can actually capture any kind of damage. through the lungs. We also have brain scanning techniques because we've also seen that a lot of people have had issues with the brain. So imaging wise, we have techniques that we can utilize to see if there's been organ damage um, due to COVID-19. Okay.
Now, when should they start utilizing those diagnostic tools? Like when after they start getting better, so that way they can start documenting long term what it is that
I would only do it if you have continued symptoms for several months, really.
Mm-hmm.
You know, because it'll take time, and you can come back into your normal, but it might take time because it is a big battle that your body is fighting. So
I share a similar concern with Sarah in chat. She's asking that more people are noticing side effects with the Moderna vaccine versus Pfizer. Do you know what could explain that?
To talk on that, would race actually play a role in this? How people are affected?
So from the studies that they did, the side effects actually were pretty similar. Let me see if I have which is like okay. Okay, I'm gonna give you the PowerPoint because like the questions people asked were really, really interesting. Even somebody even asked about chicken eggs to see because they're allergic to it. So, or you know, should I take Motrin and all that stuff, right? So I don't know if there's been any study that has taken into account because it's so fresh where people were receiving vaccines in the last month or so to actually document other than experientially who's having more side effects than not. If you are having side effect, don't be panicked about it. In a way, if you think about it, it really is saying that the body is mounting a response against this antigen, right? So that means your body is definitely responding and getting prepared for it. Does that make the Moderna more effective than the Pfizer? I don't know the answer to that question.
Is both Moderna and Pfizer in a live vaccine or a dead one?
Oh, they're actually, there's no live.
No.
Nothing live in those.
It's just the crowns, right?
It's just the epitope that they're attaching. So they're creating, the RNA is creating this structure that attached to that epitope. Remember the crown on the tip? And then so that your body can recognize that as a foreign substance. Okay. So it's not live. Let's see. Actually, I saw several questions in Q&A, so I might as well see if I can get.
Yeah, let's go ahead and wrap this up at like 4:30, so maybe we can get to some of these.
Okay. Yeah, I'm sorry for going over time, but I still see that we haven't lost participants, so that's good.
No worries. In fact, we were actually scheduled for an hour and 30 minutes, so this is good.
Well, that's why I was stressing them. Okay, so is there a way to know if I had COVID at the beginning of 2020 and treated as flu? How do I know if I have antibodies? Okay, so there are antibody tests that are available. Okay, they're not 100% accurate, but when they are showing that you have the antibody, they're 98% accurate. Okay, I hope that answered that question. So you can get an antibody test done. Okay, so between Moderna and Pfizer, is one better, safer than the other? The studies so far have not indicated that one is better or safer than the other. I have read that Pfizer did not have much Asian patient studies, whereas Moderna is more inclusive and has higher efficiency for Asians and Latinos. I am not aware of that per se. And again, I don't know. I am sure that within the next few months, we're going to have enough data to start publishing the difference in the outcome when Pfizer was given to the Asian population or the Latino population versus Moderna, and if there was any data that suggests that there was any difference. I have not seen a study that points that out. So they say Pfizer for Asians is 74% efficiency and Moderna almost 100%. How do race factors into, well, that's an interesting question. Race factors almost into everything. because our genetic makeups get passed along with our relatives and our genes. So there are certain diseases that are more prevalent in certain race than other races, right? So very similarly, you can have that. I just have not seen a specific study that says that that Pfizer is more, or that Moderna is more effective in Asians than in not. If somebody has that, please, if you can, put it in chat or email that to me or to Audrey. I'd really love to see it. And
can I put your email in the chat, sir?
Hmm?
Okay.
Yeah, sure. Isaac, no problem. So Isaac, I'm gonna have Gabe just give the email address so you can send me the MRI for the review. No problem.
Okay. Yeah, very important question, sir. They're asking about a sauna joke.
Oh, sauna joke now. If you, oh goodness, Michael, seriously, you guys
don't give in to peer pressure, Dr. Khan. It's okay.
Okay, fine. I'm gonna give in. Okay, it's gonna be really corny. Okay, I don't want you to like. It's a doctor joke.
So the best ones.
so patient comes to the doctor, and the doctor says to the patient, "Mr. Smith, I have some bad news and some very bad news." And so the lab called with your test results, and they said you have 24 hours to live. So Mr. Smith says, 24 hours? That's terrible. What's the very bad news, doctor? The doctor says, I've been trying to call you for the last 24 hours.
Oh, no.
Okay. Are you happy, Michael? You happy? Okay, maybe not. Michael Richter was asking for the joke. I'm assuming that he's probably sad that he asked, but anyway. If you've had COVID, will you need the vaccine? Really, really good question. You should have the antibodies already. Medically speaking, you should not have to get the vaccine. Okay. Again, we don't know in terms of the variants just yet and what kind of mutations are happening. But once you have been sick, you have the antibodies and you have the B cells. If antibody test is positive, do you still need to get vaccination? In my opinion, no. I've had other doctors tell me because they've had COVID and they still got the shot because they said, what the heck, why not? Had I tested positive already, I would not get the vaccine, me personally. Okay. Why expose your body to something that you don't, like medically, scientifically speaking, need? Okay. Great questions, by the way. You guys. I mean, you can keep them coming. Can the COVID-19 vaccine give me COVID? Okay, you guys see that on the screen. That was a really good question. So none of the currently developed COVID vaccines have the live SARS-CoV-2 virus, so they cannot give you COVID. If I already had COVID-19, do I need the vaccine? Right? Somebody just asked that question. It's been answered. Some people say yes, you should still get it. Now, natural immunity is unpredictable. I really, I wouldn't get it, but if someone wants to get it, I think you're fine. I don't have an issue with that. Can immunocompromised persons get the vaccine? So we don't have any data on immunocompromised people. So, the answer to answer yes, I don't know, but I can tell you that people that are at higher risk, I would, if I was immunocompromised, I would take it. I would get the vaccine. Who will get the vaccine first? We know already that it's the hospital, the first line of defense, and nursing homes are getting it first. After that, the elderly, age on down. Okay. When we will have enough vaccines for most people to get it, I believe from all the data that I have seen, mid-April, we should have widely available vaccines for everybody. Okay, so be careful, hold on tight. We're gonna have a great summer. Try to avoid COVID before then if you can.
Sir, on that, for the vaccines, the variants, will the vaccine still be effective with the variants, or could that potentially the vaccines need to be reworked?
They should be effective. They should be
Okay.
effective because the 99% even higher of that variant is still the same viral code.
Got it.
Okay. Some people actually had asked the question, why should I, should I worry about the vaccine was made so quickly? Well, I don't think that the steps were skipped per se, but one thing you should know that COVID has been around for a long time, right? By the way, COVID-19 doesn't mean that it's been 18 prior variants.
What does the 19 stand for?
It was 2019 when it was identified. I actually literally I saw on television a politician, I will not mention her name, saying that, well, what the heck, what's wrong with this? We've already had 18 versions before. Why can't we come up with? It's like, no.
Oh, boy.
Anyway, besides the point. So we have been working on this on COVID itself. I told you it's COVID-2 previously, but in my lifetime, I have never ever seen so much money and so many brilliant minds working on a singular problem for this intensely. So because of that, that was warp speed. Okay, that's really it really did, and we do not know the long-term consequences of this, but certainly we do know that it's effective because people now, millions have gotten the vaccines, and there's only a handful of cases that have been reported as having COVID-19 after the vaccine, and we don't know whether they've already intubating it or not. Okay. How many doses do you need? I told you already, 2 days, 21 days apart for Pfizer, 28 days for Moderna. What if I get the first dose but not the second dose? I would say that I would try to get both doses if I were you, just to be the most effective and long-term. But Moderna is fairly effective, 85 to 90% with the first dose. What if I missed my second dose? Go get it. Let's with the second dose, and if it's really late, then check with your doctor to see if you can actually start over again. Okay. Am I protected as soon as I receive the vaccine? Can I stop wearing a mask? I would absolutely tell you not to stop wearing the mask. And like I said, we don't have all the data, so we might as well. And then there's variants. We don't know what. So let's just be more careful, and let's get it all under control, and at least make it to the summer where we can pretty much hopefully flatten everything out. I know we're almost okay. We are at 4:30. Let this be the last question. Somebody had asked me about food allergies and medication allergies. These vaccines, at least Moderna and Pfizer, they're made from mRNA. They're not made, and there's no chicken eggs or meat products inside these vaccines. So consult your doctor if you have been vaccinated before and have had serious allergies from that. They can give it to you, and that's why they'll make you wait 15 to 30 minutes, even if you have not had severe reactions. When you get the shot, they're still making you wait 15 to 30 minutes because they want to make sure that you're not having any anaphylactic shock. Okay, so that was, I think, the last of it.
Can we get one more? If somebody is pregnant, do they have to worry about the vaccine?
There you go, right there. Somebody did ask that question, and I'm glad somebody's repeating it.
Okay.
There were no pregnant women and women that were breastfeeding enrolled in the mRNA vaccination trial. So we have no data. I did look into that, and we have no data when it comes to that. So, pregnant persons are at high risk for more serious diseases, and I'm not giving an answer to that question. I think.
Well, I love how active the chat has been, and it's been great. Like, you're back and forth with that. I've learned so much today. Oh my goodness. So I think if anyone else has questions, please be free to email us at events@Injury Institute. We'll get that over to Dr. Khan, and let's go ahead and wrap this up. Thank you, Dr. Khan. Thank you, Gabe, for being with us.
You guys are awesome.
Thank you.
As always.
Honestly, I hope that this wasn't not overly complicated. I was trying to keep it where you guys could actually, kind of capture the gist of what this is. And hopefully now you understand the virus better,
Definitely. Definitely. Well, everyone, that's us signing off from Injury Institute, and have a lovely day. Take care.
Thank you.
Bye,
Bye,
everyone.
everyone.